Hi, I'm Dr. William Mayer. I'm the Chief Medical Officer at St. Mary's Healthcare in Amsterdam, New York. And I'm here to talk a little bit about myself and what I do here and why I'm involved in Catholic healthcare. I've been on our staff here for about 30 years, leading up to the change in position. I was in private practice, admitting patients here. But one of the things I've always liked about working at St. Mary's is that sense that we're here for more than just the physical part of patients, is we're here for also the spiritual aspect of them. And one of the struggles I had coming here and leaving my practice was that I was thinking that I might lose some of that as I came on staff, but actually it's been just the opposite. I've been able to continue to engage with patients on a spiritual level as well as a physical, and that's something that I find very rewarding. And continuing the ministry of Jesus in healing, and I feel very much a part of that, even more so than I used to in my previous practice, because I was healing one or helping one person at a time, but now I can help hundreds and changing policies and programs that we have here to make patients that much better in terms of their well-being and reaching those who are the poor and the vulnerable, which we're here for. I could tell you that since I've been here, some of the exciting things have happened. I've been involved even in my office is close to the cafeteria, and we had an individual that passed out recently, had a cardiac arrest. I was able to be one of the first responders, which normally I wouldn't be if I was up on the medical floors upstairs, but I was actually being engaged in helping get him stabilized until the rest of the care team came around. But it was interesting to watch how everyone was responding, in that everyone was really concerned. Not only in the cafeteria, people who weren't members of the care team would step away. We had security help us open up the hallways to get the patient upstairs once they got stabilized, and it was really quite rewarding in seeing everyone come together for the same purpose. And at the end of the day, I feel a sense of pride because I'm working with other individuals who have the same goals in mind. One of the things I like about our work here is that we start every meeting, pretty much every meeting, with a reflection, stepping back and seeing where we are, and taking a step back and say, okay, we're here for this purpose, not just here to figure out this problem or this issue. And that really is, I think, important, setting the stage right before we get started. Gives me a sense of pride, gives me a sense of wanting to smile at the end of the day. I personally like to inject some humor into some of our meetings because I think humor and laughter is a good way of medicine for people. That's even scriptural, and I think they find out now it helps immune systems too if we laugh a couple times a day. And even though we're dealing with difficult subjects, life and death, during the meeting, just try to lighten it up and get everybody to refocus and see that we're really doing something that's important here. Again, I'm just really happy to be here as part of the St. Mary's Healthcare team and as part of Ascension Health too.